Hello everybody, my name is Carmen. I'm the practice management trainer here at Golden Valley, and I want to give you guys some brief information in regards to our patient portal. Some of you may already be familiar with patient portal and how to access that token from the patient's chart. Others may be very new to this and have no idea how to go about that. So we're going to go into that first, and then I'm going to also give you guys some tools that you can use in regards to maybe talking to the patient about the portal, giving them some information as to how they can go about signing up, creating usernames, user passwords, and also some of the information that's provided for them in their patient portal. We want you to be a little bit more informative. That way, if a patient does have questions within your center, you're able to answer those for them. So let's go ahead and get started with the tutorial on how to access that token and give that to the patient. There are a few different ways that we can generate a patient portal token. One of the ways that I'm going to show you today is going to be through the chart lookup, which is going to be on the practice management in the appointment scheduling book. So at the very top of your screen here, there's this chart lookup. We're just going to go ahead and click on that. And once you click on this, the patient lookup box should populate. When that populates, then we want to put in our search criteria. I'm going to go ahead and put in the patient's name. When we look for that patient's name, everything with similarities is going to come up into our matching records. So at this point in time, I can see that I have all of these test patients, and right next to their test patient name is going to be the patient portal tab. And with this tab, you can view to see if this patient already is currently enrolled in the patient portal, which it'll have a Y next to that person's name. If they are not, then it'll have an N. So the way that we can do it from here to generate a token is just to right click on the highlighted name of the patient that you're looking at. You can go down to the patient portal, go over to enrollment, and manage their enrollment. Once you're here in their patient portal enrollment screen, then you'll be able to see what the status of their current enrollment activity is. Currently right now it says enrollment pending, so this patient has been given a token, has just not gone in to sign up for the actual patient portal. If at this time the patient states that they lost their token number or they need to get a new one, we can always go down to our new token here, click on our new token, which will generate a new token number, and then we can print that for the patient with the instructions on how to sign up for the patient portal via their mobile phone or also from their home computer. If a patient has an email address, it should be listed here, and anything concerning their patient portal will go to their email address. If they do not have an email address, again, they will just be asked to verify another form. That way they can go ahead and sign up for the patient portal and create a username and password. So on somebody who already is enrolled in the patient portal, you'll be able to see that more functionality is available for them in regards to online forms and sending messages. So if we wanted to see if this patient has patient portal access, we would also be able to open up their chart. Upon opening up their chart, they're going to have several different charges and alerts on their file. But in addition to that, you're also going to be able to see where we would notice if they were signed up for patient portal. So if they're signed up for patient portal, it will be right here on the right hand side of their chart, indicated by this little blue icon. And also at the very bottom where you're signed in on your status bar will also show you that little blue icon. So there's a couple of different ways that you'll be able to tell whether or not somebody is signed up for the patient portal, or whether this is a good opportunity to have some of those conversations and have them, start using the patient portal to access their chart and other functionality. If you're here at the screen, you can also go over to this Norton button that looks like a little document and open this up, and also you can go to the patient portal and enrollment and manage their enrollment. Again, this patient has already completed their activation. They're currently enrolled, and if they wanted to reset their password, we would be able to do it from this screen, which would give them a new token number, and also it's going to give them updated information to their email. Very, very simple to view if a patient is currently on patient portal or needs to be given that information. So once again, please don't be scared, hesitant to talk to the patient in regards to the patient portal. It's going to give them a lot of accessibility to their file. It's going to give them a chance to be able to speak with the medical staff. It'll also give them a little bit more peace of mind knowing that they can go in there and access their information at any time and not worry about some of the business hours. So if you have any questions on any of this material, please do feel free to reach out to me and send me an email or call me and let me know that you have some questions in regards to this. Let's talk patient portal. This is a how-to guide on talking with patients in regards to patient portal. The patient portal serves as an online tool for patients to access their health information. In addition, it allows patients to keep track of appointments, medication, and message staff. The patient portal provides the patients with the best quality health care possible interactively. It is a collaborative effort by both the provider and the patient. In addition to the services, rights, and privileges patients have at Golden Valley Health Centers, patients are also requested to adhere to the following portal patient responsibilities to ensure a successful partnership and quality healthcare services. For information to be made available to you through the patient portal, please consider the following. And this is things for the patient to consider. We want them to make sure that they are keeping us up to date with all of their current medical issues and any information that they have on any medical care being provided elsewhere. We want to make sure that they're following the treatment and advice given by their care team and their provider. They can also message the staff if they need to ask a question about maybe their visit that they just had, a question on medication, and vice versa. The staff is also able to message the patient this way if they have some more information or instructions that they would like to give the patient after their visit. We also want to make sure that the patients do realize that the medical staff does have a full schedule every day and that they would need some time in order to respond to some of these requests. Usually it's going to be about 3 business days. It can be sooner, but we do want to set the expectation at 3 days. They also want to make sure that they have all of their settings current and up to date. So if the patient's moved locations, if they've changed phone numbers, or if they've changed their email address, we want to make sure that they change that. That can easily be done through the patient portal by the patient themselves. The personal health records in the patient portal are accessible in the following form. So they will have limited information that they can view at all times. If they would like their full medical record, then they will need to request that just by simply pushing one of our options within the portal homepage. That'll be very accessible for the patient to receive those, and they will receive it right to their computer. There will be no paper form sent to them. So Golden Valley Health Centers is not liable for personal health record information in the following situations: when a patient either steps away from their electronic device and leaves their account unsupervised and logged in, if they leave their electronically accessed information in a public area unsupervised, if they forget or leave printed personal health records in areas outside of Golden Health Valley Centers, when you do leave downloaded files on a public device, or after you've obtained access to your patient portal, your portal settings are set by you, the patient, to fit your personal needs. Please notify your care team if you need assistance with the settings feature. Things to consider in regards to the patient portal. GVHC believes that our patients should have access to all the available information that is being sent over via patient portal and will not exclude data deemed sensitive, for example, HIV, code gene, etc. The following guidelines will be followed to ensure that we are compliant based on California law. For minors, we need to enroll newborn to 11-year-olds and allow the use of a caregiver. The caregiver has full access to the patient's information. When a patient turns 12, caregiver access is to be removed from the minor's account, and the patient will need to establish a new password to access their data. They will be asked to sign an acknowledgement that they were informed of the sensitivity of the data. Form is to be scanned into the ICS and made available on the patient portal for reference. So we want to make sure that we're scanning all of their information into the document management so that's visible to anybody who needs access to it. For adults, any adult can enroll in the patient portal. To inform parents of minors' rights, a statement will be listed on the adult consent that states if a minor between the ages of 12 and 18, California law dictates that minors have the right to their own private information and they do not need to share with a parent. So some features of signing people up for patient portal is going to be engaging the patient. When the patient comes into the office for their appointment and after everything has been complete and done and the registration documentation has been acquired, we want to start to generate conversation with the patient. If the patient is going to have a seat in the waiting room and now they're just waiting for the medical assistant to take them back into the provider's office, this is, some time that we can take to talk to the patient in regards to the patient portal and let them know how easy they can access it with one of their mobile devices if they have on them. So we can simply say, Mr. or Mrs., I would like to let you know about a great way to access some of your medical information from your smartphone, mobile device while you wait for the medical assistant to take you back to the exam room. May I show you how easy accessing your information will be? The patient might reply with, yes, of course, that sounds great. I'm glad Golden Valley Health Centers offers that service, or I'm so sorry, I don't have a smartphone, but I would like to have access to my medical information from home. So you as front office staff can let them know that it's fine either way, that they can go ahead and sign up there in the office through their mobile device with the patient portal app, or they can sign up at their home from the convenience of their home computer with the access token that they will be granted. A couple of other situations where you might want to give some information would be when the patient is there, you give them a token, and also you want to hand them some patient information in regards to the patient portal, which if they're unfamiliar with the patient portal, you can take some time right now to let them know what it is. It's going to be a patient portal giving them access to some of their medical information. Also, it'll let them keep track of any future upcoming appointments, past appointments, medications that they've been on currently and in the past. Also, if they'd like to request a refill, they can do so. Schedule appointments at this time is also possible, so they have a variety of things that they can do from patient portal. So here we have the view of when a patient would first go into the patient portal, be it by mobile app or by their home computer. Now on the left-hand side we have the mobile app version, and here at the very bottom is going to be I am new here. That is where they would press to create a new account. If not, then they just go ahead and sign in with their username and password that they've already generated. On this other side here is going to be the home computer desktop view. So on this one, we would go ahead and have the patient enroll now, which is for first-time users. On the mobile app, as soon as you press the I am new here, it's going to take you to a different section which will ask for their token number. Here we would put in their security token number, then an email address if they have one, and a date of birth. Now don't worry, if they don't have an email address, that's okay, because what they'll do is they'll have to put in their last name to verify who they are, along with their date of birth and their security token. After that's done, then they would click on Submit, and it would enroll them after a series of questions concerning security, and they just want to make sure that the only person to have access to that file is going to be the patient or either their caregiver. So this is what the first homepage looks like after they've signed into their patient portal. It will have several different tabs along the top, letting them know what they're able to look at. Most of these are very self-explanatory. Mail would be a way to reach out to the medical staff. The schedule is going to be how they would look at any of their appointments. And again, they have all of that down here as well in these boxes populated. So if they did have anything current, as far as any emails coming into them with any messages from the doctor's office, it would be here. Upcoming appointments would be displayed, and also any reminders that they have that they can put in themselves. This is the page in regarding request appointments. From the above tabs, we're going to want to schedule, and then once that schedule has been populated, we're now going to get an appointment request. Here we would just put in whatever the practice is, the provider or the group that we need an appointment with. We would select the category and also the location. Once that's done, we're going to have them send all of that information, and it's going to go to the specific tasking group that will take care of scheduling that appointment for them. Here is a view of appointments that they've had in the past, what the status was as far as them keeping, canceling, no-showing, things like that. Patients may also view their medication list and request a refill on medications without refills. Patients will click on Renew Medication tab and then select Practice. The patient will check Medication box next to desired prescription and make any comments that they would like to have read by the medical staff. If the patient would like to communicate with any of the medical staff, they can do so by selecting Mail, the Mail tab from the top of the options. 3 of those options are Compose, Inbox, and Sent Items. So thank you again for your attention. If you have any questions, please contact me or the Patient Portal Help Desk, and we'll be happy to assist you. My name again is Carmen, the Practice Management Trainer, and at the very bottom of the screen is my email address. Thank you very much, and have a wonderful day.